COVID cases are at their highest levels ever, and hospitalizations are not far behind.
But as WDRB's Travis Ragsdale explains, the current wave could peak by the end of the month.
COVID cases are skyrocketing.
We're all tired of it, but it's still here.
Our positivity rate is higher than it's ever been.
Kentucky's percentage of positive cases is just over 27%. Indiana is in the same boat with a positivity rate of just shy of 28%. And the daily case count charts in both states show exponential growth with no hint of stopping.
Our numbers are much lower than the actual cases that are out there. Omicron is one of the most contagious viruses we have ever seen.
But for weeks now, state and federal health leaders have said that because the Omicron variant may be less serious for vaccinated people, that raw case numbers aren't the best metric of the pandemic. Instead, many experts say hospitalizations might be a better way. But now there's a problem. Hospitalizations are reaching record levels too. 2,011 people are in the hospital with COVID in Kentucky right now. At this point, 90.2% of ICU beds are occupied. Indiana now has more people with COVID in the hospital than ever before, with 3,467. 90% of ICU beds are occupied, with 38% of those with COVID patients.
If you fill up hospital beds as quickly as we're seeing, I've already had to call out the National Guard. Then that next person in a car accident might not get the care they need.
But there could be hope on the horizon. The Omicron wave is in a nosedive in South Africa, where it was first discovered, and the same thing is starting to happen in several European countries. According to several models, the U.S. might not be far behind.
What they are telling us is that they believe the peak will occur in January, that we haven't hit it yet in most places, but that in the coming weeks, and I don't think anybody has an exact time period, that they hope that it will peak.
Travis Ragsdale, WDRB News.